Hi everyone. So when I posted my last video about gallbladder disease, there were some questions about having had the surgery and still having pain. So, the first thing is that there's no surgery that has a 100% success rate. So I guess let's say that up front. But more importantly is that the success rate of gallbladder removal is dependent on what the diagnosis is to start with. So for patients that have the gallbladder removed because of an infection, cholecystitis, or because of gallstones, where the patient has a situation where they eat fatty meals and they immediately have or they have symptoms that follow with right upper quadrant pain, then those patients tend to do quite well with the removal of the gallbladder. There's another group of patients that their symptoms are a bit more vague. Maybe they don't have stones, and the diagnosis of gallbladder disease was made by a test called the HIDA scan. The HIDA scan is a functional test where you get to have some dye injected. It goes to the liver, it gets excreted, it goes to your gallbladder, and then they measure how quickly the gallbladder ejects the bile, which is now radio labeled, right, with the dye, how quickly your gallbladder ejects it out of itself into the small bowel. And that can diagnose blockages and all of that. But the most important in this scenario is, does it diagnose that the function of the gallbladder is low? So typically we say if the gallbladder is putting out, or the function of the gallbladder is less than 25 to 30%, on that HIDA scan, we say that the patient has something called biliary dyskinesia. Because that is a functional diagnosis, we typically, number one, want to make sure that there's nothing else that can explain the patient's symptoms. But perhaps most important, and the way that you can mostly decide if the patient is going to do reasonably well with the surgery, is, does the patient have classic symptoms of gallbladder disease? So do they have pain that is related to eating? If they do, there's a good chance that when you remove your gallbladder, the pain gets better, the symptoms get resolved. But if they don't, then you have to be, very realistic in your expectation that removal of your gallbladder might not actually cure the issues, the pain that you're having, especially if that pain is really dissociated from eating, then, the removal of your gallbladder may or may not help. And so in that situation, that you have a HIDA scan that is suggestive of biliary dyskinesia, but you don't have classic symptoms, if you go ahead and you have your gallbladder removed, and you don't feel better, then my recommendation would be to go see a gastroenterologist to see if there's any other